All right, assessing the hip flexors here. What we're gonna do, and you can do this on your own, you don't need another person doing it. I'm just doing it for the purpose here on my wife. You're gonna hug one knee, so bring it to the chest. You wanna make sure the back's flat on the bench. And then what we're gonna do here, the knee locked out, I'm gonna raise it up. I'm gonna slowly lower it down. And right now we're looking at the hip flexor. And the goal here is to get the hip and the knee where the knee is below the hip here. So this is a pass test on this side. We can also assess, so if that's the hip flexor, we can also assess rectus femoris or quad tightness as well. So what we're gonna do is bend the knee, and the same thing. We're gonna lower down, and we wanna make sure the knee gets below to the front of the hip. A failed rep on the first one is gonna look like this. As we lower down, it's just gonna be like we're running into a wall, like not going anywhere. And then on the failed rectus femoris test, we're gonna see one of two things. We're either gonna come down, and it's gonna be like we're going into a wall, or as she comes down, the knee is going to extend to make up for the tight quads right there. A common compensation we're gonna see with this too here, so hug this side, is as the leg's coming down, as we hit that point of tightness, we're gonna try to move in the path of least resistance, and that can start to look like the hip internally rotating out to the side. A lot of times that's probably gonna be from a tight hip capsule or TFL, just as a side note there. And keep in mind, all of these orthopedic exams I cover on my page, they're great for assessing and tracking our mobility, because what gets measured, we're actually gonna make progress with. But keep this in mind, we are simply using these tests for that. We're not using this to assess our pain, because if you were to reach out to us, if you were having back pain, and if you wanna hit the link in the bio, you can schedule a movement assessment call with us. But if you would reach out to us, we would take a detailed history. Based upon that history, it would tell us what tests we need to use, and we would use a series of tests to rule certain things in, rule certain things out. We just don't do one test and we're like, oh, this hurts. That's the cause of your pain. That just then leads us down an avenue of doing other tests. So once again, if you reach out to us, it would be within a series of tests. We are not using this to diagnose your pain here. So keep that in mind. Now, with that said, if this was a range of motion you struggled with, let's go over how to lengthen and strengthen it so you can actually start making progress with it. For that rectus femoris, or basically the tight quads, if we have tight quads, we're going to use a modified couch stretch where we're on an incline bench. This is going to put tension or emphasize the quads, as opposed to if we did a couch stretch on the floor, more of the times it's going to hit the front of the hips there. So we want to hit the actual quads. So what I like to do is think about slight posterior pelvic tilt. You can think about squeezing the glute of the side that you're working, which will do the same thing. Tilt the pelvis. And then from there, with that tilt pelvis, I'm going to rock back, pause for a second, come out of it. Every time I like to slightly reset my pelvis, rocking in, rocking out. And ideally, we're getting a stretch from the front of the hip down to the knee, so we're working that quad there. For the hip flexors, we're going to use, I don't want to call it a couch stretch, because calling it a couch stretch, people make the common mistakes associated with the couch stretch. We're going to call this a modified hip flexor stretch. We're going to set the knee up anywhere from 6 to 12 inches from the wall. So already, the first thing, most people associate a couch stretch with the knee against the wall. We're not doing that here. Next, I'm using a stability ball. You can use a medicine ball, a box, a bench, it really doesn't matter. I'm just resting my upper body on something so my torso's relaxed, my abs are relaxed, my lower back's relaxed here, and we'll cover in a second why. Now in this position, I'm thinking of the cues of squeezing my glute and or tucking my pelvis under. Those two cues will put a tremendous amount of tension in exactly where we want to feel the stretch in the front of the hip. You have a bone right in front of your hip called the ASIS. We want to feel 90% of the tension in that area. So once I get in this position, I'm hunched over on my ball, I'm squeezing my glute, and now in this position, I'm thinking about driving my ASIS, my gosh, that's a mouthful, that bone towards the floor to accentuate that stretch while squeezing the glute. You can hang out here, you can rock dynamically in and out, and these small nuanced cues, or the devil's in the details, make all the difference in making this a more effective stretch in stretching the area that we're actually trying to hit as opposed to the couch stretch. Inevitably, what happens with the couch stretch, or the biggest mistake people make with the couch stretch, is they get into this position, they crank themselves up, and they're borrowing all this mobility, or I hate to use the word compensating, but they're compensating in their lumbar spine to get into this vertical torso position. And yeah, they're feeling a stretch here, sure, but the majority of the work is just being done by the lumbar spine. Let's put specific rules in place to really accentuate, isolate that stretch. Now, if you find this too easy and you need to progress it, we can do what's referred to as an elevated hip flexor stretch. All of the cues remain the exact same, but now we're simply elevating our back knee so we can get more leverage getting into the stretch. And also keep in mind, a progression can be with the knee on the floor. The closer we do get the knee to the wall, the bigger stretch we're going to get here. But most people, they don't need to be that close to the wall because their hips suck. That's why you're watching this video in the first place. But as you're consistent and you progress these, by all means, we can get the knee closer to the wall and then eventually elevate it. Now, same thing. I'm leaning on my stability ball. I'm relaxing my lower back, abs, torso as much as possible. And now I'm thinking about squeezing my glute, driving that ASIS towards the floor, and I'm feeling a tremendous stretch in the front of the hips. A lot of times if people's hips are extremely, extremely tight, this is where weighted mobility can come into play, because having some extra load to help get us into a new range of motion is a great way to progress our mobility, especially as we're working through years upon years of tightness here. So one weighted mobility technique we can use for this hip flexor work, and we're going to use eccentrics here. We're going to take a kettlebell, we're going to hook our toes under it, and keep in mind, a little weight goes a long way here. So we're going to get set up into the position where I'm hugging one knee on my chest. Now I'm slowly and under control lowering the weight down as slow as I possibly can to control the entire range of motion. Now let's say we get to right here, and this is kind of our area of tightness. Really lean into the weight to try to get a little additional overpressure here. Hang out for a moment, and then what I would do is come up so we're not lifting ourselves or performing the concentric here, and then simply lift ourselves back into the position and repeat the rep again. Same thing, slow and controlled. This is no different than like a negative chin-up if you're trying to build yourself up to do chin-ups. We need to control the entire range of motion here. We're going to cover one final hip flexor strengthening movement here. Everything's been predominantly around lengthening it. I want to strengthen the front side of the hip now. So what we're going to do, the higher up the surface we're resting our foot on, the more advanced it is. I'm just too lazy to go get a bench or something because I was just sitting on this stool for the beginning of the video. Ideally, you would have two sticks driving into the ground, utilizing them for balance as well. Driving the sticks into the ground will also help keep good tension from head to toe. So what I'm going to do is I'm just going to hold onto this rack for balance. Good upright spinal position. All I'm going to do is lift my foot off the bench here. Hold it for about 5 seconds. I like 5 seconds as a rep. Then we come back down. Each time I repeat a rep, I would rethink about driving my sticks into the ground or keeping this good upright spinal position. We want to avoid leaning back to compensate. We want to avoid bending the knee to compensate. That's shortening the lever. If you have to do those things, simply go with a lower surface that you're resting your foot on. But once again, good upright spinal position, lifting the leg up for, like I said, 5 seconds, coming back down. You'll probably get some cramping in the front of the hip and or the quad. Totally fine. That's what I like to refer to as neurological confusion. The best way to get that cramp to subside, do a little light punch into your quad and the cramping should chill out. All right, to close this out here, so a couple things I want you to keep in mind. First of all, we are not using this test to assess for pain. If you're struggling with back pain, there's a link in the bio. Click it, schedule a movement assessment so you can identify that first step and get clarity on what the F is going on. Now, with that said, if you're simply using this to improve your hip range of motion and you have no pain, the guidelines or the rule of thumb when you think about performing these things, this is no different than training a squat or training a deadlift. You're going to hit it hard. once, maybe twice a week, depending on age, ability level, and you recover. That's it. This mobility work, especially the more advanced ones we covered, hit it hard and then recover. This isn't something, in my opinion, you should be doing every day. There is a place, by all means, for lower intensity, longer duration static stretching. That's a whole different video. But for the purpose of this, like, don't be doing that eccentric hip flexor with the kettlebell every single day. You're going to overdo it. You're going to hurt your hip. You're going to strain something or hurt your lower back. So a little goes a long way. Think of this no different than if we're trying to improve our squat or improving our deadlift. Keeping that mindset and that mentality will prevent you from overdoing it with this.